So my involvement with Prize for Life dates back a few years now, and I think like many of us involved in the organization, it was stimulated by my meeting Avi Kramer, the founder of Prize for Life, who was a student at Harvard Business School when he was diagnosed with the disease. Prior to that, I'd had a scientist and, if you will, a drug developer's interest in ALS. We hadn't directly worked in this area for a number of reasons which we can get to later. But I think it was really Avi's experience and his passion for accelerating the course of ALS research and therapy that really got me interested in the organization. Well, actually, I think the good news is that a lot more attention is being paid to ALS these days, and not in small part because of the attention brought to it by Prize for Life itself. Historically, it's been a difficult disease for pharmaceutical companies to be interested in. I think people who study neurodegenerative diseases in academia have been interested in the mystery of ALS for a long time, but pharmaceutical companies have been not uninterested in the disease, but I think at a loss with regard to how to approach it, because we know so little about the underlying causes of the disease. So when you don't understand the basis for a disease, it's very hard to think about developing sensible treatments. Well, I think they come in two forms, right? On the more proximal and practical sense, things that help physicians and pharmaceutical companies understand whether or not their drugs are working. In other words, better measurements of impact on the disease would be very helpful, both for stimulating interest but also for allowing us to understand whether experimental drugs are working. I think more fundamentally, some of the new tools of genomics and genetics are providing us better molecular insights into what the causes of the disease might be. And the more we can understand about the molecular nature of the disease, about what triggers the disease, about who's at risk, about what processes are deteriorating as the disease progresses, the more we can understand the molecular signature of this disease, the more progress we'll make. So you asked me earlier how I got interested in Prize for Life, and I said a lot of it had to do with Avi. And part of that had to do with my initial response to him, which was prize model. Never been tried in biomedical sciences. Interesting challenge to see if one can make it work. And so I think when we talk about the prize model and how effective it can be, Prize for Life is really at the cutting edge of exploring this area. It is certainly, the model has certainly been useful in areas outside of biomedical research to stimulate interest in an area, to shine a light on a topic, to encourage people in other fields to come and work to solve that problem, because the incentive of the prize is a powerful one. And I think Avi's vision is that those kinds of motivations should spill over. I think we've seen some of that happening with Prize for Life and the incentives that are being offered, and we're seeing, if imitation is a sincere form of flattery, we're seeing other organizations copy the model. And I'm excited about that. However, we should be realistic about the fact that this is not a model that most biomedical investigators are familiar with. So getting people to engage is a hurdle, and one that we need to pay attention to. But I think the more light we can shine on this prize model, the more we can attract investigators from other areas who are thinking about other problems. We want them to think about our problem. This is an incentive to do that. I think it's a good incentive. We want to get problem solvers to attract other sources of funding to amplify the funding that we can provide. I think that's an incentive, and a very attractive one. So we're in the middle of an experiment with regard to the prize model, but early returns are encouraging. So the nature, at the core, a prize model is not providing funding to come up with a solution. It's rewarding a solution. So participants in a prize model, contestants, if you will, in the prize model, need to underwrite their problem solving from other sources. So the prize serves as an incentive for them to seek that funding, but especially in an area of biomedicine, and I think this is where the challenge is for the prize model here. Biomedical research is expensive. It's not like starting up a software company in your garage. This requires labs, it requires reagents, animal testing. It takes a long time. It costs money. So one has to attract other funding to enable the development and the testing of these solutions in order to qualify for the prize. That need amplifies two things. It amplifies funding. It brings money in from other sources because the prize itself isn't funding that work. And the second is it draws in increased attention to the problem, because as you go and seek funding for your solution, you have to make other funders aware of the problem and why it's worth solving that problem. So you have an amplification of monies toward the solution, but you also have an amplification of awareness. And I think in many ways, amplification of awareness is as important, especially in a disease like ALS. So ALS falls into a category of progressive neurodegenerative diseases for which we have little understanding. They are also the kinds of diseases that take a tremendous toll on the quality of life. ALS particularly strikes people in their most productive years. And it's a disease that has not had the visibility that, let's say, Parkinson's disease or Alzheimer's disease has had. It doesn't make the disease any less devastating for the people who have it, and it doesn't make the disease any less a problem for the impact that it has on society, for the productivity and the creativity that we lose. It's an important disease to try and treat. It has been an extremely mysterious disease, however, and our insights into this particular disease really haven't changed much over the last several decades. The same can't be said for Parkinson's. We know more about the molecular basis of Parkinson's, for example. We are learning, with some success, more about the causes and approaches for treating Alzheimer's, but with limited success, I have to say, in that area. But the attention paid to Alzheimer's is certainly amplifying the amount of work that's going on. ALS is no less devastating a disease, as I said, because it strikes people in their productive years and because it's a rapidly progressive disease in many cases. So it's an important time now because I think the molecular and scientific tools for actually making progress in this disease are in better shape now than they have been ever. So the time is better now to really make some strides against this disease. And I think the impact will be significant, not just for the people afflicted, but for much larger hunk of society. Well, I think, we talked about this before. What does the prize model do? The prize model enhances monies that can be used to support solutions, and the prize model also enhances visibility. And that's what supporters of Prize for Life can also bring to the table, right? I won't be so naive as to say money's not an important thing here. Money's important to support the prizes and also some of the auxiliary projects that the Prize for Life does. Equally important is broadening the awareness around this disease so that we can get more scientists developing better tools for studying this disease, discovering fundamental insights about what causes this disease, persuading pharmaceutical companies that investments in therapeutic approaches to this disease will be medically and commercially rewarding.